Hi everyone. Thank you for the opportunity to speak today. My name's Dr. Yvonne Laird. I'm a lecturer in prevention and health promotion at the University of Sydney. I co-lead a programme of work funded by the Australian Prevention Partnership Centre, which seeks to build capacity for citizen science approaches amongst policy and practice stakeholders in prevention. As part of this work, we're conducting a case study evaluation of policy and practice-led citizen science approaches in prevention, which I'll speak about today. Before I begin, I'd like to acknowledge the traditional owners of the lands on which I'm speaking to you today, the Gadigal people of the Eora Nation, and pay my respects to elders past and present. Citizen science is an umbrella term for a range of activities that directly involve members of the public as active contributors to the research process. These activities can include developing research questions, contributing to research design, collecting data, analysing or interpreting data, and contributing to the publication and dissemination of findings. Depending on the aims of the specific project, participants can be involved in any number of phases of the research process, although an involvement in collecting and/or interpreting data is usually a core component of citizen science approaches. Health promotion and chronic disease prevention is complex and requires intersectoral action on many levels to improve the environments in which we live, work and play. Engaging the public in research and decision-making in health promotion is crucial to being able to achieve equitable, feasible and acceptable solutions to the complex health challenges we face. And many agencies across Australia and internationally are grappling with how best to engage the public in meaningful ways. We think that citizen science offers considerable promise as an approach to engaging the public in health promotion through its potential to incorporate diverse perspectives on problems and solutions, build community capacity for action, increase public awareness in health, and improve the relevance of research and decision making. We've recently conducted a scoping review which sought to understand how citizen science approaches have been used in chronic disease prevention in order to identify the gaps, opportunities and challenges. Briefly, we found projects using citizen science approaches have increased rapidly over the past 10 years, as shown on the graph on the right-hand side of the slide. Most citizen science projects used a citizen science approach to identify problems from the perspective of community members, to generate and prioritise solutions, to monitor or evaluate existing interventions, or to build community capacity or partnerships to drive local change. However, most of these studies were researcher-led, with little attention to the potential for policy and practice-led citizen science approaches. Our programme of work, funded by the Australian Prevention Partnership Centre, seeks to build capacity in the use of citizen science approaches in policy and practice settings. As part of this programme of work, we're supporting 4 health promotion agencies across Australia in the design and implementation of their own citizen science project. Wellbeing South Australia are using citizen science to evaluate community gardens, with a particular focus on accessibility and usability of the gardens. And they are working with council partners to implement this project. The South West Sydney Local Health District project are using citizen science to evaluate an urban regeneration of a local town centre from the perspective of employees and local residents who use those spaces. Again, they're also working with a council partner to implement the project. The Vic Health project is using citizen science to gather data on the kinds of unhealthy industry advertising that young people are being exposed to online with a view to bring about policy and practice change. And finally, the Rural Walkability project in Tasmania piloted the use of citizen science as a means of capturing the features of rural towns that impact physical activity. We conducted in-depth interviews with 18 stakeholders across the 4 project teams to explore their experiences of applying citizen science approaches within their work. The data presented today reflects the first round of interviews, which were conducted at the very early stages of projects, and we're currently in the process of conducting follow-up interviews, which we're conducting at the end of the citizen science projects. Across the 4 projects, stakeholders talked about different motivations to using citizen science approaches, including as a means of engaging with diverse communities, to generate new evidence. They were interested in citizen science as a tool to support advocacy for policy and practice change, and to test the feasibility and utility of citizen science approaches to address the needs of their organisations. Some of the risks and enablers that were identified included organisational readiness, so having the support of senior managers within the organisation, but also having staff capacity to learn and apply a new method. Identified implementation challenges related to recruitment of citizen scientists, managing relationships with project collaborators, and navigating a new way of working. There was also delays and restrictions due to COVID-19 and ethical issues such as remuneration of citizen scientists. Some of the early impacts that were discussed included increased awareness and familiarity of citizen science approaches, and this was both within the partner organisations and more broadly. Some stakeholders also discussed citizen outcomes, so things like increased knowledge and examples of citizens engaging in advocacy efforts. Before I wrap up, I wanted to share some resources on citizen science and prevention that we've put together as part of our programme of work for people who are interested in finding out more or using these approaches as part of their work, including a citizen science video, fact sheets and case studies. And we also coordinate a community of practice on citizen science and prevention, where we invite speakers to share their experiences of applying citizen science approaches within their work. And the community of practice is open to anyone with an interest in citizen science and prevention to join. And if you are interested in that, then I'll share my contact details on our project website, where you can find out more about the community of practice and our other resources. If you'd like to find out more about this project, my contact details are listed on this slide, and there's also links here to our project website and a link to sign up to our newsletter. I'd just like to say a big thanks to our project team, and I'd also like to acknowledge the Australian Prevention Partnership Centre for funding this programme of work, and also acknowledge the funding partners of the Australian Prevention Partnership Centre listed on this slide.